In Nigeria, community health practitioners are the unsung heroes of primary health care. They walk through villages, reach the unreached, and deliver care where hospitals may never exist. They are the heartbeat of the nation's community health system. But once they cross Nigeria's borders, their story changes. The license that gave them authority at home suddenly loses its power abroad. Why does this happen, and is there hope for global recognition? Let's explore. The license to practice as a community health practitioner is issued only by the Community Health Practitioners Registration Board of Nigeria, a statutory body operating under Nigerian national law. Unlike nursing or medicine, this license exists only within Nigeria's legal framework. Most foreign countries do not have any equivalent licensing category for community health practitioners as defined by Nigeria's Community Health Practitioners Act, Cap C-19, Laws of the Federation of Nigeria 2004. So when Nigerian community health practitioners migrate, they often discover that foreign systems have no direct equivalent, leaving them professionally stranded. But if licensing is only part of the challenge, what about how health professions are structured abroad? In countries like the United Kingdom, Canada, and the United States, similar roles exist, such as public health nurses, health visitors, or community health workers. However, these positions typically require university degrees in nursing or public health, and registration with their own national health or nursing councils. It's important to note that, although nursing curricula differ slightly across nations, they all follow shared international standards developed by the World Health Organization and the International Council of Nurses. That's why a nurse trained in Nigeria, Kenya, or India can often work abroad after verification, because their education meets global benchmarks. Community health practice, however, does not yet have such a unified framework. Its training and regulation are uniquely Nigerian, highly practical and community-driven, but not internationally harmonized. So, could the real difference lie in the training level and educational pathway itself? Let's take a closer look. In many countries, health professionals are recognized only if they hold degree-level qualifications. In Nigeria, most community health practitioners are trained at the diploma or certificate level. Their training is rigorous and hands-on, focusing on real community impact rather than academic theory. Yet, because it is not globally standardized, it often doesn't meet equivalency requirements abroad. But this is changing. Under the visionary leadership of the Registrar and Chief Executive of the Community Health Practitioners Registration Board of Nigeria, the Community Health Program has now been successfully mounted in Nigerian universities. This marks a historic turning point, bridging the academic gap, aligning the profession with global higher education standards, and opening new doors for international recognition. But education alone is not enough. What about global partnerships that make recognition possible? Professions like medicine and nursing benefit from strong global accreditation frameworks and mutual recognition agreements that allow practitioners to migrate, retrain, or register across borders. Community health practice, however, is still developing those bridges. The Community Health Practitioners Registration Board of Nigeria has not yet established formal collaborations with World Health Organization, recognized health councils, or other international credentialing agencies. But there's immense potential here. While community health practitioners do not yet have a global accrediting body, Nigeria's board could partner with the likes of World Federation of Public Health Associations, WFPHA, AFREhealth, African Forum for Research and Education in Health, and World Health Organization's Global Health Workforce Network, GHWN. Such partnerships could pave the way for cross-border recognition and mutual accreditation of community health practice qualifications, linking Nigerian-trained practitioners with a truly global health framework. And as these international bridges begin to form, a quiet revolution is already taking place at home, one that could redefine the future of community health in Nigeria. Change has already begun. The integration of community health programs into Nigerian universities is more than an academic milestone. It's a statement of global intent. It shows that Nigeria is preparing its community health workforce not just for local relevance, but for international alignment and mobility. The future is clear. With continued leadership, stronger educational standards, and global collaboration, the Nigerian community health practitioner will soon stand recognized, not just as a national asset, but as a global professional force. Because every community deserves care, and every practitioner deserves recognition. If you found this insightful, don't forget to like, share, and subscribe. Together, let's celebrate progress and support the rise of community health practice in Nigeria.